I think fertility medicine and treatments are for whatever reason are still taboo in many of our dinner tables and parties, and that's unfortunately something that's still there. And the only thing we can really do about it is open up. I think when someone is going throughout this process, it's okay to tell friends, it's okay to talk about it. And every single patient that shares their story, either on social media or otherwise, they're really helping someone else, because when you're going through this, you're feeling that you're the only person that's going through this. And then once you realize that it's something that's quite common, a lot of people treat fertility treatments unfairly in that respect. Another important aspect is that some patients will say things like, well, I haven't been able to have a kid on my own or without fertility treatment, so maybe I'm not meant to have kids. Maybe that's what's intended to me, or what God wants, or something like that. And and I always find it fascinating that everyone goes to that in regard to fertility, but then everything else, that's not the case. So if someone is having a heart attack and an artery is clogged, you're going to go and you're going to have your catheter and the stent, and they're okay with all sorts of interventions. And maybe in that case, if you wouldn't do anything, then maybe that person wouldn't have lived, right? But everyone's okay with helping that person, by all means. But then if you can't have kids, somehow it's like a double standard. And then why would you, it's not natural to help. And I just find that very interesting psychologically. But anyway, let's break all that and let's talk more about infertility, fertility treatments. And so I really applaud you to bringing this to attention of everyone. And I think that's really, every one of us needs to do a little bit so that we can finally overcome all of this taboo.